Hi, I'm Jack from realign.co.uk, and today I'm going to be talking about broken femur injury treatment. It's important that you know that you may be entitled to free private medical treatment from a broken femur specialist local to your area. Also, if needed, you could receive guidance and advice from one of our panel of private specialists who might suggest you use a special boot, crutches or cast in order to allow your injuries to heal quicker. Now, broken femur injuries may differ, as no two injuries are the same. Speaking to a private specialist without having to worry about any hefty medical fees could make all the difference in terms of your recovery. If you had an accident that was not your fault, you could qualify for free broken femur treatment from a specialist in your local area. Contact us to find out if you're eligible for free private treatment from a broken femur specialist. That may also include physio treatment if needed, by calling our free phone helpline on 0800 652 7676. We're open 24 hours a day, 7 days a week, and we offer a no-win, no-fee service. We're also going to be going over some of the steps that we recommend you take, as well as looking at information provided by the NHS in regards to dealing with an injury involving your broken femur. If you have any questions or requests, let us know in the comments, and if you like this video, please do hit that thumbs up button, as this will help us see what type of content people find helpful. If you've sustained a broken femur injury following an accident that wasn't your fault but was down to the negligence of others, you should bear in mind that you may be entitled to compensation. In order to bring a claim for compensation, we recommend that you speak to a personal injury claims specialist that has experience in dealing with femur injury claims. You may qualify for free private treatment if the accident which resulted in your injury was down to the negligence of others by bringing a claim for compensation. You won't be expected to pay anything up front, and we'll ensure that all costs are covered if you decide to bring a claim with us. So call 0800 652 7676 in order to find out if you're eligible, or visit our around-the-clock live chat service at legalexpert.co.uk. We're open 24 hours a day, 7 days a week, so you can speak to us whenever you'd like. Now, according to the NHS, if you think you or someone else has broken their leg, go immediately to your nearest accident and emergency department, that's A&E. Call 999 for an ambulance if the injury seems severe or you're not able to get to A&E quickly. Now, while you make your way to A&E or wait for an ambulance, avoid moving the injured leg as much as possible. Keep it straight and put a cushion or clothing underneath to support it. Do not try to realign any bones that are out of place. Cover any open wounds with a sterile dressing, a clean cloth, or a clean item of clothing. Maintain direct pressure on the wound if it keeps bleeding. If the person is pale, cold, or sweaty, in shock, lie them down and carefully rest their legs above the level of their heart to improve the blood flow. When raising the broken leg, ensure that it's kept straight and supported by a cushion. Keep them warm and calm until you can get medical help. How a broken leg is treated. Now, immobilization. First, a doctor will give you painkillers and may fix a splint to your leg to secure it in position and prevent further damage. For severe pain, you may be given painkilling gas through a face mask or medication through a drip into a vein. Now, an X-ray will be done to assess the fracture. If the broken bone is still in position, you'll usually just need a plaster cast. This holds the bone in place so it can heal. If there's a lot of swelling, you may just have a splint or cast around the back half of your leg until the swelling goes down. A full cast can be fitted a few days later. You may be provided with painkillers to take home and information on how to look after your cast. Reduction. If the bones are misaligned, a doctor or surgeon may need to put them back into place. This is known as reduction. Sedatives are sometimes provided before the procedure, and local or regional anaesthetic is used to numb the site of the break. In some cases, a general anaesthetic is needed, which means you'll be put asleep during the procedure. Now, once the bones are in the correct position, a plaster cast can be applied. Surgery. Severe fractures are often treated with surgery to realign and fix the broken bones. Surgeons can fix the bones with metal wires, plates, screws and rods. Plates, screws and rods will usually be left in place permanently unless they become a problem, whereas wires will be removed 4 to 6 weeks after the operation. Sometimes an external frame, external fixator, is attached to the broken bones with metal pins to help keep them in place. Now this is removed once the fracture is healed. After surgery, a plaster cast may be applied to protect the leg. Follow-up appointments. An appointment will be made for you to attend a fracture clinic so specialist orthopedic doctors can monitor your fracture. The first appointment is usually booked for a week or two after your discharge from hospital. Now, severe fractures would usually heal within 3 to 6 months, but may require follow-up appointments every few months for a year or more afterwards. Further x-rays are often necessary to check how well your leg is healing. Recovering from a broken leg. Now, you'll be given advice by your doctor about how much you should move your leg and when you can put weight on it. It takes around 4 to 6 weeks for a minor fracture to heal. You'll probably need to use crutches or a wheelchair during this time until it's possible to put weight on the leg again. You'll be shown how to safely use any mobility equipment you're provided with. More severe fractures can take between 3 to 6 months to fully heal. Some can take even longer. The hospital may recommend regular physiotherapy appointments to help you maintain or regain muscle strength, movement and flexibility. This will include specific exercises to do before and after the cast is removed. Do not try to rush your recovery by returning to your normal activities too quickly, as the broken bone may not be fully healed even when the pain goes away. Follow the advice of your doctor, who will probably recommend gradually increasing how much you use your leg over time. You should not drive while in a cast. Seek advice from your doctor about when you can drive again. Possible complications. For most people, a broken bone will heal within a few months and there will not be any further problems, but complications can sometimes occur. Damaged muscle, nerves or blood vessels. Damage around the fracture can occur during the initial injury or during surgery. It may lead to loss of movement or feeling. It may affect the blood supply to the limb. Bone infection. This is more likely if surgery is performed or the broken bone stuck out of the skin. It can significantly delay healing and will often require treatment with antibiotics, surgery or both. Compartment syndrome. Compartment syndrome is a painful and potentially serious condition caused by bleeding or swelling within a bundle of muscles. This can occur soon after a fracture, after the plaster cast has been applied, or after surgery. Now, emergency surgery will usually be needed to relieve the buildup of any pressure in your leg. Other complications. Occasionally, a further operation may be needed if the bone does not heal properly. This can happen if the bone doesn't align properly during surgery. You put too much weight on the bone before it heals, the fracture is severe, you have diabetes, or you smoke during your recovery. Types of fracture. Some broken bones are more serious than others. It depends on the location of the fracture, how the bone has broken, and whether there's any damage to the surrounding tissue. The most common types of fracture are stress fractures, tiny cracks in the bone caused by overuse, common in athletes. Undisplaced or hairline fracture, a fracture through the bone with little damage to the surrounding tissue. Displaced fracture, the two parts of the broken bone have moved apart. Comminuted fracture, the bone is broken, shattered into several pieces. Open or compound fracture, a complicated break where the bone has broken through the skin or the initial injury has exposed the broken bone. So if you've been involved in an accident which has resulted in a femur injury and you believe that you're entitled to compensation, we'll be more than happy to hear from you. You should bear in mind that if you're successful in your claim for compensation, the cost of any private treatment should be covered, as well as any loss of income from time off work which may be claimed back for when bringing a claim for compensation. Now, if we take your case on, we'll be more than happy to put you in touch with a medical specialist in order to further aid your recovery and aim to find you one in your area so that you're not having to go out of your way should you require any further treatment to help your recovery. Of course, the circumstances of each incident are never the same, and whether or not you believe you have a valid claim, it's always advisable that you speak to an expert on the matter. So if you'd like further assistance, we are personal injury claim specialists. We offer free, friendly advice on no win, no fee compensation claims, so there's not a penny to pay if you lose. Get the maximum compensation that you deserve. We're rated 4.8 out of 5 stars and we have specialist solicitors with up to 30 years experience. It'll only take just a couple of minutes for our team, who'll be happy to answer any questions you may have to help establish whether or not you have a valid claim. Call now on 0800 652 7676 or visit our live chat service at legalexpert.co.uk. Don't forget to subscribe, as we'll be uploading helpful videos just like this one on a regular basis. You can also check out one of our recommended videos or head over to legalexpert.co.uk, where you can read community questions on our forum, get free advice from our live chat, read articles and seek assistance for compensation on a no-win, no-fee basis with your personal injury claim.